Due to a long history of systemic discrimination and racism, Black women have become one of the most marginalized groups when it comes to their health and medical care. African American women are 3.5 times more likely to die from complications from childbirth than Caucasian women. Within the last couple centuries, women in first world countries have had vastly improved medical care when it came to childbirth, and some of that is thanks to Marion Sims. However, ethical concerns arise when it comes to his controversial legacy, as all of his experiments were done on enslaved women. His revered reputation as the father of modern gynecology is upstaged by the exploitation and these enslaved women's lack of consent. Their names were Betsey, Lucy, and Anarcha, and those are just the names of the women we know. This is the story of Marion Sims, the father of modern gynecology. I'm your host, Lauren Powers, and you are listening to Not Your History Class podcast. Our standard education has barely touched upon the depth, violence, and tragedy of human history. My intention with this podcast is to illuminate the parts of our history that have been in the dark for far too long. I want to take a comprehensive dive into our world and to give a different and new perspective on our past. After all, education is our strongest weapon against tyranny. Please note, this podcast contains content and information that may not be suitable for children under the age of 13. Please be advised. Born January 25th, 1813 in Hanging Rock, South Carolina, Sims was the oldest of 7 siblings, and his parents were Jack Sims and Mahala Mackey Sims. His family owned a small farm and later an inn, although there's not a lot known about his childhood. In 1825, the family moved to the village of Lancaster when he was 12 years old. He began studying at the Franklin Academy in Lancaster. And 5 years later, in 1830, he continued studying at South Carolina College as a sophomore. He graduated in 1832. Initially, he had planned on going into law like his father wanted, but he decided to pursue medicine instead. He also pursued medicine because of Eliza Teresa Jones, the daughter of the local and only physician, Churchill Jones. Sims' father, Jack, was disappointed by his son's decision to pursue medicine. In 1833, Sims started to attend medical lectures at Charleston Medical College in Charleston, South Carolina. His family did not support this career. He also started to apprentice with Jones and started courting Teresa. He left Charleston Medical School without getting a degree and enrolled in Jefferson Medical College in Philadelphia in 1834. This was at a time in the 19th century when treating female patients was considered offensive and unsavory. His own education in medicine was fairly limited. At that time, doctors didn't need to have the same amount or the same level of education as they do today. He had essentially taken a 3-month course, studied for a year at Jefferson Medical School, interned with a doctor before starting out with his own practice. A year later, in 1835, he graduated Jefferson Medical School with his MD. He then returned to Lancaster and opened his own practice. He lost 2 of his patients that were infants and moved from South Carolina to Alabama, eventually settling in Montgomery County. And the next year, in 1836, he married Teresa, and together they had 9 children. 4 years later, in 1840, they moved to Montgomery, Alabama, where he had a lucrative practice treating slaves. He started to build a reputation among rich, white plantation owners. His practice was deeply rooted in the slave trade. Sims didn't actually have any specific gynecological training. In August of 1845, Sims was called to help a woman who had fallen off her horse and was suffering from what Sims labeled as an acute retroversion of the uterus, which is now referred to as a tilted uterus. At that time, in order to receive a gynecological exam, a woman had to lay in the lithotomy position, laying on the back with the knees bent. However, this patient was a larger woman and he was having a difficult time giving her a proper examination. He created an alternative method with her called the Sims method. The patient lays on their side with the knee pulled to the chest and the other leg extended, which shifts the pelvis so that air fills the vaginal cavity, creating a vacuum until it fully distends. A bent spoon was then used to peer at the internal cavity. As the tool was improved by other doctors and it evolved, it became known as the Sims speculum. In the southern United States, vesico-vaginal fistulas were common, especially with enslaved women. This would happen with traumatic childbirth and can happen or developed with prolonged obstruction in labor when the baby will not fit through the birth canal. The contractions attempt to force the baby through the birth canal, but instead the baby becomes more wedged in the pelvis until it can no longer be moved. At that point, the soft tissues, the bladder and the cervix and vagina, are becoming trapped between two bony plates, the baby's skull and the mother's pelvic bones. There is no blood supply to those tissues. The baby then can unfortunately pass away from asphyxiation, and the mother could pass away from uterine rupture, sepsis, or hemorrhage. Pressure on the vaginal wall causes tissues to rupture into the bladder, which means that patients experienced uncontrolled seepage of urine through the vagina, which was constant. There also could be a seepage of feces as well. Doctors attempted to create surgical treatments, but they didn't succeed very often, and so the condition was deemed incurable. The victim of this prolonged obstructed labor can suffer from infertility, damage to the birth canal and pubic bones, neuromuscular damage, and urinary and pelvic tract infections. Due to the constant smell of waste, it also made these women into social outcasts. Like other doctors at the time, Sims attempted to cure this condition but was not finding success. He did most of his experiments on 3 slave women, Betsey, Anarcha, and Lucy, who had all worked on different plantations around Montgomery, Alabama. Sims believed that he would be able to cure Anarcha, Betsey, and Lucy within 6 months. He had an agreement with their owners to lease the women to him for the length of the treatment so that he would have unfettered access and control over their bodies. Sims wrote a, quote, proposition to owners of Negroes. If you will give me Anarcha and Betsey for experiment, I agree to perform no experiment or operation on either of them to endanger their lives and will not charge a cent for keeping them. But you must pay their taxes and clothe them. I will keep them at my own expense. End quote. Anarcha was about 14 years old and Lucy was about 18 years old and had given birth to a child 2 months previous to being given to Sims. He had also bought at least 10 enslaved women, or these women were given to him by their owners. The owners did not feel like they were valuable because they could not do hard labor, which made the enslavers money. So to the owners, it didn't matter whether or not they suffered, it just mattered that they were able to work for them. The owners would give Sims these women with the hope that they would be able to cure them, in which case they would become much more valuable. He housed them in a makeshift hospital he built behind his house. The hospital contained 16 beds, 12 for patients and 4 for servants. Sims claimed that these enslaved women clamored for the operations to relieve their discomfort, but it is not notated that they consented with any of these operations. Vanessa Northington Gamble, a professor at George Washington University, said, quote, "These women were property. These women could not consent. These women also had value to the slaveholders for production and reproduction. How much work they could do in the field, how many enslaved children they could produce." End quote. The procedures were often very painful. At the time, it was believed that Black women did not experience the same amount or as much pain as white women did. So any sort of pain-numbing medicine was not used on these enslaved individuals. There was also a belief at the time that African American skulls grew too quickly around their brain, which made them less intelligent and less able to feel pain. This is obviously a belief that was deeply rooted in prejudice and racist beliefs. Anesthesia was not widely used at that point, and it wasn't until October of 1846 that it was used by dentist William T.G. Morton and surgeon John Warren at Massachusetts General Hospital in Boston. That being said, there were several other kinds of pain-numbing medication, such as opium, ether, chloroform, and laudanum that could have been used. Sims said of these experiments and of Lucy, quote, "That was before the days of anesthetics, and the poor girl, on her knees, bore the operations with great heroism and bravery. I had about a dozen doctors there to witness the series of experiments that I expected to perform. All the doctors had seen my notes often and examined them, and agreed that I was on the eve of a great discovery, and every one of them was interested in seeing me operate." End quote. The first surgery that Lucy endured, she became very ill afterward, as Sims had used a sponge to drain the urine away from the bladder, which led her to contract blood poisoning. It took her about 2 to 3 months to recover entirely from that operation. Lucy had been the first of the enslaved women to undergo his experimental operation, and the operating room was filled with doctors who were interested in watching the procedure. We talked previously about the lack of consent in this situation, and I want to reiterate that this was not something she was ever asked if she consented to. She was brought into the operating room completely naked and was restrained on the table. They didn't want her involuntary movements to disrupt Sims' procedure. Her experiment took an hour and she was awake the entire time. Unfortunately, she developed an infection from the surgery. She spent several days in a great deal of pain. He was able to cure the infection, but she still had the vesico-vaginal fistula. In other words, the operation was a failure. Betsey then went through the experiment, experiencing the same events that Lucy did, and was also not given any pain-numbing medication. She did not experience an infection, but her injury was still not fixed, and the operation was considered a failure. While he became proficient in sewing the fistulas closed, he was unable to cure them. Patients would have swelling at the wound site. They would struggle with inflammation and microbial infections due to the use of unsterilized silk or sutures. Anarcha followed the same path and had the same results. When news of the failed operations became public, the medical community decided that they no longer were going to stand behind Sims and support his experiments. Anarcha, Betsey, and Lucy were left with Sims because they were considered to be useless without a cure. They would also work for the Sims family during the periods of their procedures and recovery. Sims' white male assistants quit, and so he started to train Anarcha, Betsey, and Lucy to be his assistants while he operated. He also taught them how to nurse each other back to health. These medical conditions essentially made them social outcasts, and due to them being under the control of Sims, they were removed from their family and their communities. Summer of 1849, he started to use silver metal sutures for internal stitching. On Anarcha's 30th surgery, he used these metal sutures, and she made a complete recovery. In order to make certain this wasn't a fluke, he performed the same operation on Betsey and Lucy, and they both recovered. According to a 2006 Washington Post article, quote, Anarcha Westcott endured 30 surgeries as Sims worked to perfect the technique. She was among about a dozen slaves on whom Sims operated repeatedly without anesthesia, which was just being developed and not widely used at the time. Some scholars have questioned whether the slaves gave or were capable of giving informed consent to the surgery, despite Sims' claims that they eagerly sought his cures. End quote. He was able to expand his practice and had patients from all different walks of life. While he had not used anesthesia on the enslaved black women, he would use anesthesia when it came to doing surgery on his white patients. That same year, he started struggling with an illness that was likely malaria that nearly cost him his life. He published his findings in January 1952, called, quote, On the Treatment of Vesico-Vaginal Fistula, end quote. He did not mention Anarcha, Betsey, or Lucy as those who had helped him significantly improve his studies. Any illustrations that were in his article were of a white woman who was covered modestly and with respect, which is something that the enslaved women never received. Sims moved to New York City in May 1853, having recuperated. His monetary funds were low as he had not worked in over a year. Other doctors didn't see any reason to hire Sims after he had published his findings. He was unable to find work as a doctor. In 1854, getting desperate for work, Sims made a public request to a women's hospital. Sarah Platt Dormus answered his plea, and she, along with other socially influential women, helped Sims set up the Women's Hospital of New York in May of 1855. In 1862, he moved to Europe, settling in Paris, spent the rest of his life as a sort of celebrity surgeon, ministering to European royalty and continuing to perform surgeries, showing off his cure for vesico-vaginal fistulas. He had opened his first ever women's hospital, but still continued to test controversial medical treatments on patients. He would refuse to take responsibility for his methods if a patient of his died, and instead he would blame, quote, the sloth and ignorance of their mothers and the black midwives who attended them, end quote. In 1876, he was named the president of the American Medical Association, and in 1880 became president of the American Gynecological Society, which he had helped found. Sims passed away at the age of 70 on November 13, 1883. He's considered to be the father of modern gynecology. He was the first United States physician to have a statue erected in the 1890s, which was located on the edge of Central Park, across from the New York Academy of Medicine in New York City. In 2017, a group of women from the Black Youth Project 100 wore hospital gowns that were splattered with red paint. They demanded that his statue be taken down. On April 17, 2018, the New York City's Public Design Commission voted unanimously, and Mayor Bill de Blasio ordered its removal. The statue was taken down and was moved to his grave in Greenwood Cemetery in Brooklyn. There has been a proposal that a different statue could be put up that honors the memory of Lucy, Betsey, and Anarcha, as well as other enslaved women that were experimented on by Sims and other physicians. As I try and present historical information to my listeners, I also try to keep it relevant to what is happening in today's society. There is still a level of racism within the medical community when it comes to the treatment of Black women and the health disparities that result from systemic discrimination. The maternal mortality rate remains 3.5 times higher than of their white counterparts. Women like Anarcha, Betsey, and Lucy must not be forgotten for the suffering that they endured in order to improve the lives of other women. They should be considered the Mothers of American Gynecology. An important thing to note is that due to Sims' work, the vesico-vaginal fistula has virtually disappeared from developed countries, but an estimated 2 million African women still struggle and suffer with this debilitating issue. I want to end this episode with a quote from Joel D. Howell, a professor of the history of medicine at the University of Michigan. Quote, "One of the most visible ways racism was made manifest was in multiple instances of physicians carrying out unethical experiments using African Americans." End quote. If you are looking for sources for this episode, please check out our show notes. Transcripts and sources will also be on my website, notyourhistoryclass.com. Researching, hosting, and production and editing is all done by Lauren Powers. Theme song and episode music is done by Mike Myers. You can find him at the Mike Show 42 on X. If you have any recommendations or suggestions for a future episode, you can direct message me via social media or email me at notyourhistoryclass@gmail.com.